Hello and welcome to the screencast on transfer and generalization. I want to do a very brief discussion on these two ideas and why they're important to treatment in aphasia, but not only in aphasia, in treatment in general. But I'm going to, of course, do this through the lens of aphasia. So I'd like to start by talking about transfer. When we're engaged in therapeutic interaction, whether that be remediation, compensation, or counseling, we would like for the skills that the individual has to either transfer at minimum or generalize at maximum. Okay, so I want you to get a sense of what we mean by these two terms. The first is transfer, and transfer is when a person can use the same skill, but they use it in different contexts. So for example, if I taught a person with aphasia a set of phrases that they could use during conversation, a kind of maybe script training approach, where I've trained a script and now they can do those phrases in therapy with me, I would like them to transfer and use those same phrases outside of therapy with other people. So my expectation is only that the things that were trained in therapy will transfer to other contexts, other people, and other kinds of interactions. Or another example would be if I taught a person 3 names of family members that they commonly interacted with because they wanted to be able to say the person's name, and they were able to say those names in therapy. I showed them pictures and they were able to say the person's name when presented with the picture. The transfer of that would be that when they left therapy and they were interacting with that person, they could use that person's name with them. Right? But there would be no expectation in a transfer situation that this person would necessarily be able to produce other names other than the 3 that were trained. When we start to talk about that, we're talking about generalization, and that is learning a skill that generalizes to other skills. So some examples of generalization might be we're learning that set of phrases for the conversation, and as the person is using those phrases in conversation, other phrases start to emerge that were not trained, and they start to contribute to conversations at the phrase level that were never practiced in therapy or used in therapy, but they're emerging, and they're emerging because of the success that's happened with the trained phrases. Or the example of learning the 3 names would be the person has learned these 3 names, and now we start to see the emergence of other family members' names when they're interacting with those family members, based on the idea that there has been some kind of generalization of naming skills across different sets of words that were untrained. So it's this idea of generalization occurring in untrained items that makes it generalization. When it is the person using the trained items, it's transfer. So I'm going to take you back to kind of a pediatric example. If we went back to the idea of articulation therapy, where maybe you're using some cards and you're having the child produce, let's say, the R sound, using a set of cards, you're really banking on generalization. You're not trying to get the child just to be able to produce the R sound in the set of cards that you have. You want them to be able to produce R sounds in any word, and you might be starting by saying, I want to do that in the initial position of words. I want them to be able to produce R in the initial position of any word. So the idea of generalization is really, I guess, the holy thing that we go for, right? The big idea that we hope we get is generalization. But oftentimes we don't get generalization. We might in a childhood artic case, but in the case of an adult with aphasia, we might not get generalization. So then we have to look to transfer. What can we transfer from what has gone on in the therapeutic activity? And I would say, how do we plan for transfer and generalization? How do we get this person to understand that what's happening in this therapy room needs to go outside of this therapy room? To do that, we're going to need good home programming. We're going to need to have specific guidelines for the person and their family to follow. They need to know what they need to do outside of therapy, when they need to do it, how often they need to do it, and you need to hold them accountable for that. I tell students a lot that you've given this home program, but you've never checked whether they're doing it or not. They're learning that you give them stuff to do, but they don't have to do it because you'll never ask them again about it. So it means holding people accountable. How's that program going? What happened? How did you feel about it? What needs to change? Again, that interaction with the patient, that idea that evidence-based practice is about the patient being involved in their care. The patient is giving input into what's happening. Those are going to be key components to getting transfer and generalization. So as we think about those two ideas, it brings me to the idea of participation. That the ultimate goal of therapy is that the person be able to participate in activities in the ways and in the places that they want to participate. And that programs like the life participation approach to aphasia, which we've talked about or will be talking about, interact and try to promote the person participating in the world and how what they are doing in therapy changes what they do outside of therapy. That's just so key. AAC is one way to help people participate by giving them a means to participate in conversation, in communication, but so is their natural abilities. Any good AAC program assesses what the natural abilities of the person are and helps that person to learn how to use their natural abilities better as they participate in the world. So as you think about therapeutic interventions, I would like for you to always keep at the forefront of your mind the idea that your goal is participation of this person, and that participation is going to occur when transfer and generalization of skills within therapy is promoted and monitored and is systematically attempted in the therapeutic process. Thank you very much for your time, and I hope that as you continue in your career, you'll continue to think about this idea of participation, transfer, and generalization.